How fast you get back to work after breast cancer surgery will depend on what kind of surgery you've had, and it can range anywhere from 2 days to as long as 8 weeks. So most women heal very well after breast cancer surgery, but the time it takes for you to get back to work will depend on what type of surgery you've had. So after a lumpectomy, most women heal very well and very quickly. Usually after a day or two, you're back to doing almost all of the things that you want to do in your daily activity, like walking around the house, eating, feeding yourself, showering, and all of those normal activities. So if you have a job that doesn't require too much vigorous activity, if you wanted to, you could go back to work after a couple days, although I would say that most women will plan to spend about a week off of work so that they can relax and regain their energy at home. If, though, you have a job that requires a bit more physical activity or heavy lifting, I would recommend that you take that first full week off of work rather than returning too quickly, because you may not even have your full range of motion, your strength, or your energy back by then. And you want to make sure that your wounds are adequately healed before you go back to that level of activity. Now, after a mastectomy, it does depend on whether or not you've had reconstruction to determine how long it takes for you to get back to work. For a mastectomy without reconstruction, I would consider that along the lines of someone who's had a lumpectomy, except that you probably will have drains in your breast after your surgery, and those drains are things that you want to take care of and make sure that they don't pull out or drag, and sometimes that can be a lot to manage while going back to work at the same time. Typically, drains stay in the breast after a mastectomy without reconstruction for approximately a week, so most women will plan for a week or sometimes 2 after their surgery before going back to work. Now, mastectomy with reconstruction, though, is a whole different category because it will depend on what kind of reconstruction you've had. Reconstruction that uses tissue expanders or implants will generally require at least a couple weeks off of work, and some women will take anywhere from 2 to 4 weeks off of work to make sure that you are have overcome your discomfort, and that your drains are out, and that your plastic surgeon has cleared you for activity as well, because a lot of times your range of motion is a bit more limited after that type of surgery. The final category, though, is reconstruction with autologous tissue, which means tissue moved from one portion of your body to your breast to recreate and reshape a breast. And that one requires the longest period of time off of work. Most plastic surgeons will allot approximately 6 to 8 weeks off of work for that type of reconstruction, because there is a lot of healing that has to be done. And we want to make sure that you're healed, that you have your energy, that your pain is under control before you get back into the workplace.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.